Hello and welcome to Feeling Good. I'm Karen Hill, and today we have with us somebody that can tell us about our hearing. Dr. Kimberly Combs, and she is a doctor of audiology. Welcome, Kim.
Thank you so much for having me. It's a pleasure.
Oh, wonderful. Now tell us what a doctor of audiology does.
We help people communicate better through hearing, through better hearing. So hearing is an important part of our daily life. A lot of aspects of our life are affected by hearing, from hearing the alarm clock to talking to our loved ones to our jobs and our neighbors and friends. So hearing affects us in a large way, and we help people hear better.
And I think we're going to talk about some of the quality of life issues that you just mentioned, but you know, many of us don't understand really how the ear works. Many of us can't hear very well, but can you tell us a little bit about how we actually hear?
Sure. We have three parts of our ear: our outer ear, our middle ear, and our inner ear. Our outer ear consists of the ear canal down to the eardrum.
Okay.
Our middle ear is behind our eardrum, and then the three smallest bones in our body are behind that eardrum and attached to it. And then we have our inner ear, or our cochlea, which is and that's attached to our hearing nerve. So as we hear, sound goes down our ear canal, hits our eardrum, sends those bones into motion, which stimulates the inner ear or cochlea, and that sends a signal along the nerve and up to the brain. We hear from our brain. It's all decoded from our brain. This is just how it gets in.
So it's really our brain that's hearing. But our ear has to work for our brain to hear.
Correct.
Okay.
Our ear transmits the signal, and our brain decodes it.
Okay. You know, this is really interesting because one of the things we tell people, to age well, you need to be socially connected. And hearing loss is one of the primary factors that interferes with that.
It's really linked to depression, social isolation. So when you don't hear well, sometimes you decide to give up. People will generally repeat things 3 times before they say, oh, it's not really that important, it's okay. That doesn't make the person who wanted to convey the message feel good. They failed at conveying their message, and it doesn't make the person with hearing loss feel good. They no longer feel like they're even worthy of the knowledge or the message that wanted to be conveyed. So hearing loss is definitely associated with dementia and Alzheimer's disease. There was a long-term study done at Johns Hopkins, and the people that had Alzheimer's, some treated their hearing loss sooner than others. The population that treated their hearing loss sooner, the Alzheimer's effects took place later. So it helped stay off the Alzheimer's a little bit. And there's less brain shrinkage with treated hearing loss than untreated hearing loss. As we age, our brain shrinks, and with those with hearing loss have more brain shrinkage when it's untreated than when it's treated. So we're learning a lot more about our brain, how it functions. MRI results help us learn a lot more about our brain as time goes by, and it's been enlightening. We're learning how much more hearing loss affects us in different ways.
You know, this is really truly amazing, because I think there's probably hundreds of people out there that have hearing loss and they've not been treated, and there's so many indications for other issues if you don't. I mean, just your brain shrinkage and the dementia is reason enough.
36 million Americans with hearing loss.
Okay.
And only 2 or 3 million actually do something about it. So there is definitely a gap between those who treat and those who don't, and I don't know if it's a message of educating people on how important it really is. And you know, we're living longer these days, so our quality of life is more important for a longer period. And no matter what age, I think hearing is important because it helps us maintain our relationships with others.
And I'll tell you, when you're living with someone with hearing loss, it gets very frustrating if it's not treated. Or there's sometimes selective hearing loss, I found out too. So.
There is.
So let's talk about treating. If somebody would come to your office and say, I need a hearing test, I think I'm having some problems, what would happen?
Well, first off, we would take a look in their ear, make sure there's no earwax or any reason not to proceed, and we would do a full diagnostic test.
Okay.
Then we would discuss the results in depth. So I want you to know what your results are. And if there is a medical issue that I think that can be treated, I want to refer you back to your physician or to an ear, nose, and throat physician who can take care of that in a medical fashion. But if it's one of those 95% sensory neural or permanent hearing losses, then we're going to go ahead and discuss the solutions that are appropriate for you. So sometimes, most of the time, that's going to be hearing aids. If you have ringing in your ears, there are hearing solutions that offer sound therapy to help with the ringing in the ears. Everybody has different needs, and so we want to find out what you're doing. What's your lifestyle? Do you lead a relatively quiet lifestyle? Are you active? Are you out with the grandkids? Are you working? What do you do when you work? Do you work in an office and it's relatively quiet? Do you have difficulty in staff meetings? Do you talk on the phone? So there are a lot of we want to know about your entire life and how to make you function, how to help you function better in all settings, not just at home in front of the TV.
Well, I know one of the things you do at your office, and I'll tell you one of the most common issues for people that have had their hearing tested and get hearing aids is they don't wear them because the background noise is too loud, or they don't like how they hear through them, and you actually do some education on that, right?
Absolutely. We want to help. Nobody wants them in the drawer. The person who fits them or the person who wears them, we don't want them in the drawer. We're trying to help you hear better and help you communicate. So there are different strategies and different things work for different people. So there are just different programs that might be applicable to you, that might not be applicable to somebody else, but it's an individualized treatment plan always that we want to. Sometimes they're in groups, sometimes it's offered in groups, sometimes more people can benefit from a certain type or style of education than others, but we definitely want to educate people on hearing loss, the effects of it, how it affects you. You know, people don't understand. I had a friend who had hearing aids for about 18 months, and she couldn't understand what this certain clinking was, and it was ice because she had never heard it. So it's our brain, we have to train our brain, and that takes time. So there's a reason these are not sitting on the store shelf. There's a reason that they need to be programmed properly, they need to be comfortable, and we want you to hear better with them.
So if you're out there and you have a hearing aid and you're not using it, go back to the place you got it.
Absolutely. I would encourage that, you know, they can't fix the problem if they don't know about the problem.
Right, right. And sometimes you may have to go back more than once.
Correct. Absolutely. Sometimes it's not a quick fix, but there are thousands of different ways to program hearing aids these days. They're programmable. They're digitally programmable. There are thousands of options, you know, to set one hearing aid, and they're specifically designed for your hearing loss and your comfort levels. So they should be comfortable, and they should help in the majority of situations. Can I say that I hear everything with normal hearing? No, I don't hear everything. Sometimes I miss something. It's okay to miss something and to ask for repetition. It's when it becomes a daily event, you know, and it's repetitive all the time. If you think you have hearing loss, I think it's important to get it evaluated.
And I think a lot of people know, but again, you may be living with somebody who you think has hearing loss and they're not at the point where they can admit that yet. So you said if they're constantly asking for repetition, is that the primary clue that you can look for?
That's one of them. If you need things louder, like the TV or the radio, louder than everyone else in the household, or it's uncomfortable for other people in the household, that's a good sign. If you think people mumble, everybody mumbles, that's a good sign that you might need your hearing evaluated. Sometimes it can be something as simple as earwax, sometimes not. So,
well, let's talk. You had talked about something called an induction loop. So what's an induction loop?
An induction loop is a copper coil that can run around a room, or it can be run even around a chair. So it can be for an individual or a group. And any hearing aid with a telecoil in it can utilize an induction loop. So a telecoil is often used in a hearing aid to help somebody hear better on the phone.
Okay.
When you put something next to a hearing aid, a lot of times it will whistle. And when you talk on the phone, you want it close to your ear, but you don't want it to whistle. A telecoil turns off the environmental microphone that the hearing aid uses to hear, and it turns on the telecoil that talks to the telephone. A telecoil can also talk to an induction loop. So let's say you have difficulty hearing at church, or on a museum tour, or at the movie theater. All of those places are a great place for an induction loop to be installed. Anybody inside the loop, so basically if you have an entire room at church, whether you have 1 pew or 10 pews or the whole church looped, you have options there, and as many people as you can fit with hearing aids in a pew or in that section that is looped can literally put their hearing aid on their telecoil program, and they will be, it's like they're plugged right into the speaker system. So they're only this far from the speaker's voice. So you eliminate that distance factor that creates a lot of issues when we're trying to hear better. And when people don't hear well, distance really sacrifices the clarity that they have. So hearing aids help. The larger the distance, or the larger the space between the speaker and the listener, the harder it is. And so that induction loop takes care of that very quickly and easily.
I've never heard of that. That's a great idea for large group settings, because that's when a lot of people have trouble hearing so much, because there's a lot of background noise.
There's an entire city in Michigan that's looped.
Seriously?
Taxi cabs in London are all looped. I think they're starting to loop taxi cabs in New York City. So your bank, your pharmacy, your church, your movie theater, all of your community centers, any group area that has a speaker system can be looped, and probably should be looped for access.
So where do people get these loops if we have listeners out there that are interested in looping their living room?
I would talk to your audiologist.
Okay.
They should have a local resource, or you can certainly call me.